and y'all know where the tragus is. You'll feel that with your finger. Once you can kind of fall into that, that's going to be your joint. I'm going to ask the patient to open wide slowly and close. And one more time for me, and close. Now move your head, your jaw side to side. Okay. All right, so I didn't really feel any clicking or popping in her TMJ. I did notice as she opened that it kind of shifts to the right a little bit as she opens and then closes back up. You would ask the patient if they have any discomfort or anything, if they notice that they're able to chew fine. If you do feel clicking and popping, let's say in here, when they opened it like clicked and popped 2 or 3 times there, I'm not going to ask them to do it again, but I'm going to ask them questions about it, and then what are they doing? Have they seen anybody about it? There is not only just a click or a pop that you may feel, but something called crepitus, which just, it feels like what you would think ground glass would feel or hear it sound like. It's just a really like a crackling sound with it. Again, you can utilize that with any symptoms that they have with regards to any pain or discomfort upon opening. Are they able to eat and chew fine? You know, from there, there's some palatal things, palliative things that can be done. Cut food up smaller, don't chew gum, don't eat hero sandwiches where you have to open like this, where you have to unhinge your jaw, cold compresses, anti-inflammatories. But if it's consistent or goes more than that, they need to see a specialist about it.
What was that called?
Crepitus.
Crepitus.
I got that.
Mm-hmm. Okay.
If it pops but it doesn't hurt,
Again, you're just going to note clicking or popping if it's bilateral or unilateral. No, if there's they have no symptoms, asymptomatic.
Okay. So yeah, we're just, like you said, we're just gonna listen for any sounds as she opens and closes. And then we just need to document any notable findings in the patient chart, and then we need to follow infection control.
So most of the time you'll go from this extraoral exam into leaning the patient back and doing an intraoral exam. At that point, you need to change your gloves, right? Because I've just been all over the outside of her face. I'm getting ready to go on the inside. So I'm going to remove these gloves, do hand hygiene, and then we would go into lean them back and do the intraoral exam. Okay?
Question from earlier when you said
I'm listening.
we don't want to be opening these cabinets during treatment. So in this case, we need new gloves. Would we have gotten multiple pairs out?
No. You're going to go over here, discard your gloves, open that, do hand hygiene, get your gloves, shut it back, and come back over. Again, at this point, you're going to make sure you've had everything that you need already in the operatory. For the extraoral exam, obviously, I didn't need to use it. Oh, it feels like I'm out of a tunnel. For the extraoral exam, you don't really need anything. That's why I only put this here. Intraorally, of course, you're going to be using your light. You're going to have a mirror to be able to see. You're going to use those cotton swabs to check salivary flow. So you need to be ready to, once you're in patient's mouth, you're not coming back out of that unless you forgot something, okay?
Do we have to do all this stuff like in exact order, or can we just make sure that we get hit on the
It's easier to kind of go that direction, but again, if you missed a step during it and you go back and get that, that's fine, just as long as you've covered everything there. But it's kind of set up to make sense, if you will.
Now, are all these steps also performed on children in the exact same
Children?
manner? Children, like when we bring kids
Yep.
in?
And again, this will kind of go, the more you do it, it's going to go faster. And again, you have templates here, but you don't have to stop after everything and go over and fill that out. I would wait till the end. If you had a palpable note or something like that, that's when you would go ahead and fill that in and make sure that you documented anything that you'd ask them or any reportable symptoms, things like that. But you're going through the steps of it and then going over and filling out what you need. What I just realized on there, it didn't really ask you, well, your intro. The occlusion is on the intro, never mind. But you will have to document the occlusion. And make sure that you check both the right and left side, because it can be different. Y'all remember going over that with Mrs. Macalusa? Again, as you're having the patient close, and I know she's gonna go over this, put your fingers in their mouth, put your thumb underneath their jaw, and just have them say bite on your back teeth. And then, look at the sides, use your mirror to look at the other side. But if you just tell them to bite down, they're thinking they're helping you and they're gonna bite on their front teeth. So put your fingers in there, put your fingers underneath their jaw, have them close, bite on your back teeth. And kids will want to open and close about 10 times, so just hold it. Get it quick, get it done. All right, any other questions? Okay.